my name is Kevin. I'm from London, UK. I'm really happy to take my new voice.
My problem started when I was 12 years old.
This will definitely motivate people who are suffering from similar situations.
I have high pitch voice problem.
तो अभी तो सर मेरे को बहुत अच्छा लग रहा है, वॉइस में काफ़ी फर्क आ रहा है।
Okay. I actually had this surgery in the back and
You said, I'll take it as a challenge and I'll give you your voice back without any invasive procedures.
After surgery, I have vocal cord paralysis. And now I can speak normal. I feel good.
Hi, I'm Cyrus. Hi, my name is Cyrus.
Hi, I'm Sean. Now my voice has recovered and improved.
इसलिए मुझे बहुत ही प्रॉब्लम, मैं पहले से ज़्यादा बेहतर महसूस कर रहा हूँ।
My name is Rehabilitation from Bangalore.
And I'm very happy that I'm speaking like a normal people with a bass voice like male.
So I'm having this voice problem. I spoke with a few of my friends and they found reasonable changes in my voices.
I have been facing difficulty in speech. You are able to speak words properly and sentences properly.
Just you try to say something.
treatment the same day. After 2 hours, I got my voice.
Hello friends, welcome to our YouTube channel SLP Sanjay Kumar Voice Therapist, and today we are live after treatment with Tanmay, and today date is 3rd July 2021, and we did his pre-treatment live on June 23rd 2021, and he was having some voice problem. So Tanmay, what exactly problem you had and how do you feel after treatment? Please tell us. Please switch on the mic.
मुझे पहले हाई पिच वॉइस की प्रॉब्लम थी। ट्रीटमेंट के बाद मेरी वॉइस काफी नॉर्मल हो गई है, और जब मैंने अपने फ्रेंड्स को फोन किया फिर उन्होंने भी कहा कि आवाज में काफी चेंज आया है और अब भारी भी हो गई आवाज।
ओके, सो एक मिनट हम देखते हैं कि आपकी आवाज सच में भारी हुई है कि नहीं। एक बार हम लोग चेक करके देखते हैं। विल जस्ट सी दैट हाउ इट इज इम्प्रूव्ड एंड इट हैज इम्प्रूव्ड और नॉट। सो आई एम जस्ट गोइंग टू प्ले द प्री ट्रीटमेंट लाइव दैट वी डिड ऑन 23rd June 2021।
सर मुझे हाई पिच वॉइस की प्रॉब्लम है।
कब तो जो लोग भी इस लाइव को देख रहे हैं, मैं उनको सजेस्ट करूंगा कि आप लोग इनका प्री ट्रीटमेंट वाला लाइव भी जरूर देखिए, और उसका डिस्क्रिप्शन का लिंक हमने मतलब उस लाइव का जो है प्री ट्रीटमेंट लाइव का जो है लिंक इस लाइव के डिस्क्रिप्शन में डाल दिया है। और थोड़ी सी एक बात ये भी बता देना चाहूँगा कि तन्मय जी को थोड़ी स्टैमरिंग की भी प्रॉब्लम है, लेकिन इनके पेरेंट्स जो थे वो पिच वाले प्रॉब्लम पे, हाई पिच वॉइस पे काम करने के लिए हमें सजेस्ट किया था, तो मैंने उसी पे बेसिकली काम किया है। और जो लोग नया जुड़े हैं उनके लिए मेरा मैसेज है फिर से एक बार। नमस्कार दोस्तों, आज हम लोग लाइव हैं और अपने चैनल पे, हमारा चैनल का नाम है SLP संजय कुमार वॉइस थेरेपिस्ट, और हमारे साथ हैं तन्मय गुप्ता जी। और तन्मय को वॉइस की समस्या थी, पतली आवाज़ थी, और इनका हमने ट्रीटमेंट से पहले का लाइव किया था जून 23rd 2021 को, और उसका लिंक हमने इस लाइव के डिस्क्रिप्शन में डाल दिया है, तो आप लोग जरूर उस लाइव को भी देखिए, जून 23rd 2021 का आज के लाइव के साथ साथ। और इनकी जो वॉइस थी अब पहले कैसी थी वो कंपेयर कर सकते हैं और आज कैसी है ये भी देख सकते हैं. तो तन्मय, यू कैन टेल इन इंग्लिश व्हाट एग्जैक्टली प्रॉब्लम यू हैड, हाउ डू यू फील नाउ?
My name is Tanmay. I live in Ambala, Haryana. Confidence was very low, and now after treatment, my voice is normal. When I called my friends, they also told me that my voice is changed and it's now heavy and good.
Okay, so I'll continue the conversation a little more. So tell your hobbies so that people can hear your voice more and more, and where you, what, in which class you study, so we can speak more and more.
I study in 12th class. My hobbies are to watch movies and play video games.
Okay.
And my age is 17 years old.
Okay, fine. So the topic in this live I have mentioned the Puberphonia, signs, symptoms, cause, diagnosis, treatment. So let's discuss on those areas also, and in between I will again talk to you so that people can hear your voice as well. And so let's understand what are the signs of Puberphonia. So in case of Puberphonia, what will happen? The child age will be, the boy's age will be pubertal age, but still he will be using his childish voice or feminine voice. So we call it a puberphonia. Puberphonia means a voice problem which occurs during the puberty, and they will be having normal vocal cords. And when they will be calling on the phone, many times people will misunderstood, and sometimes they will say ma'am, they will get confused. And of course sometimes some other test also is required, but just to understand the sign means even after puberty, a boy whose age is suppose 13 year and still he is using the childish voice or feminine voice, so we can say he may be having the puberphonia. And what could be the cause? So if you explore my previous live, which the link we have given in the description of this live, so already have talked, but maybe sometime new people will be there, so I will discuss about that. To understand the cause, let's first understand like what is the normal speech production mechanism. For normal speech production, first thing is the thoughts that comes in the brain, then we take air, that air goes to the lungs. When we breathe out, we put air pressure below the vocal cord. Here we have larynx. Inside the larynx, we have two sting-like structures known as vocal cords. So once you put air pressure below the vocal cords start moving like a string of a violin and guitar, and sounds will generate. Then we modify that sound into different sound with the help of our lips, tongue, jaw, teeth, palate. For example, if you want to say p, both the lips are coming closer together and touching each other. When you want to say t, tongue is coming between the teeth. When you want to say k, back of the tongue is getting elevated and touching the soft palate. So each and every sound has own place, own manner of articulation. So when you say a one sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cords move, sound generate, we modify that sound into different sound. In one sentence, there are so many words. In each word, there are so many sound. Each sound's own place, own manner of articulation. So it is little complex process. In this process, there are hundreds of our body muscles works in a very, very coordinated way. If coordination among these muscles goes, there will be a fluency issue, like a stammering issue that you also have, but somehow we have not worked as your parents were more concerned about your high pitch voice. And if the place of articulation and manner of articulation is wrong, for example, if you want to say the, and instead of putting your tongue between the teeth, you are putting your tongue somewhere else. So the pronunciation will not be correct. So when the pronunciation problem is there, articulation problem is there, either it can be place of articulation is wrong or manner of articulation is wrong, or both may be wrong. So let's concentrate why the problem like a puberphonia. Why a boy whose age is even after puberty, why he's having the feminine voice? So it can be some other reason also, like vocal cord mass length will not be sufficient, like feminine voice, pitch voice, high pitch voice can be occur, sometimes muscle tension dysphonia, sometimes phonatory gap. But I'm talking about now the typical puberphonia case where I'm expecting the vocal cords may be normal. So what happened during puberty, mass and the length of the vocal cord increases due to a hormone called testosterone. Here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So once mass and the length will increase, pitch reduces in a very simple way. Like in case of boys, before puberty, vocal cord behave like a thin string of a guitar. If I'm comparing with a guitar string, and after puberty, due to the hormone testosterone effect, it's become thick. So now it start behaving like a thick string of a guitar, and the pitch reduces. So before puberty, the pitch will be higher, but after puberty, pitch will be lower. In case of, like I'm talking about normal situation. But in the puberphonia, what happens during puberty, mass of the vocal cord, length of the vocal cord will increase due to hormone testosterone. But the boy, like Tanmay, maybe he has used high pitch voice from childhood to puberty, and during puberty, mass of the vocal cord increased, length of the vocal cord increased, and the vocal cord is ready to produce the low pitch voice. But because of his so many years habit, because childhood to puberty he spoke in a high pitch voice, so he will not accept the new voice. He will try to maintain his childish voice. To do that, what such situation those boys do, like if they have, this is the vocal cord which has mass has increased, length has increased after puberty due to the testosterone effect, but to maintain the childish voice, they will be vibrating only thin edges of the vocal cord. So once they will vibrate the thin edges of the vocal cord which is actually thick but behaving like a thin string of a guitar, and when the guitar string will be the thin, the pitch will be higher. So you can also correlate with acoustics. There is a one relation between mass, length, and the tension and the frequency, like n is equal to 1 by 2L under root T by M. So if any string vibrates, the frequency will be directly, or pitch will be directly proportional to the tension and inversely proportional to the mass and the length. And during puberty, mass and the length of the vocal cord increases, so that's why pitch reduces. And as a voice therapist, what I'm going to do, because those who are having puberphonia, they will be vibrating only thin edges of the vocal cord. So vocal cord is behaving like a thin string of a guitar, but actually it is a thick. So I will stimulate whole mass and the whole length of the vocal cord. So the vibrating mass and vibrating length will increase. The vocal cord, which was behaving earlier like a thin string of a guitar, will start behaving like a thick string of a guitar. So even you can correlate with the formula like n is equal to 1 by 2L under root T by M. So if mass will increase, length will increase, the pitch will reduce. So pitch is nothing but it's a psychoacoustic term for the frequency. Frequency is a more physics term, and the pitch is the psychoacoustic term. And what is frequency? Suppose if I'm taking this pen and I'm in 1 second, how many times I'm just moving like that? So we can tell it's a frequency. If in 1 second, suppose if I'm vibrating, just moving like a 30 times, so we can say that the frequency is 30. It's like that. So when the mass of the vibrating string, length of the vibrating string will be more, the pitch will be less. And even very, very simple way, you can correlate with the guitar string. The guitar string, thin string produces the high pitch voice, thick string produces the low pitch voice. Before puberty, boy or girl, both will be having the thin string, like thin vocal cord. So the pitch will be higher. But in case of boys, because of the testosterone effect, the mass will increase, length will increase, so that vocal cord will start behaving like a thick string of a guitar, and the pitch will be lower in normal cases. But those who are having puberphonia, the change will occur with them also. But because of their so many years habit, they will not accept the new voice. To maintain the childish voice, they will be vibrating thin edges of the vocal cord. So as a voice therapist or as a speech language pathologist, I will stimulate whole mass and the whole length of the vocal cord. So earlier it may be vibrating thin edges, and now after my therapy, it will start whole mass and the whole length. So it will start behaving like a thick string of a guitar, and the pitch will reduce. So this is the biophysics behind that. And so what we do in the treatment, we just stimulate the whole mass and the whole length of the vocal cord. And to diagnose the puberphonia, sometimes perceptual evolution, sometimes in some cases like voice problem, pitch problem, to differentiate it is a puberphonia or it's a like sulcus vocalis or hormonal issue, sometimes detailed evaluation require. And sometimes being a professional and experienced, we just based on the perceptual evaluation also we understand that this may be the case of puberphonia. So the proper evaluation is very, very important. Treatment method for the sulcus vocalis, where nature has not given sufficient mass length and there is a phonatory gap, and the muscle tension dysphonia will be different, and in the case of puberphonia, treatment method will be different. But after hearing the voice, in all the cases voice will look like feminine. So evaluation is very, very important step to correct the problem. And now I'll be coming to the some questions part. If there will be question, I'll be discussing on those questions also. So let's and yeah, those who are watching this live, if you are able to compare pre and post Tanmay's voice change, so please like and this live and subscribe our YouTube channel and share also, so that people having similar problem can reach to a right person. So those who have joined newly, my request is please try to watch pre-treatment live as well. Pre-treatment live we have done on 23rd June 2021, and that link we have given in the description of this live. So please watch that also. And today's live already you are watching, and you can compare the voice of Tanmay. If you can see the positive change, please subscribe our YouTube channel and share this video so the people having similar problem can reach to a right person. ओके सो तन्मय, एक बार फिर से सुनाइए क्या प्रॉब्लम आपको थी और ट्रीटमेंट के बाद कैसा लग रहा है, कैसे रिएक्शंस आ रहे हैं, व्हाट यू आर गेटिंग?
मेरा नाम तन्मय है, मैं अंबाला हरियाणा से हूँ। मुझे पहले हाई पिच वॉइस प्रॉब्लम थी और उसकी वजह से मेरा कॉन्फिडेंस भी काफ़ी कम था, पर अब ट्रीटमेंट के बाद मेरी वॉइस नॉर्मल हो गई है। और जब मैंने अपने फ्रेंड्स को कॉल किया, फिर उन्होंने भी कहा कि मेरी ये वॉइस में काफ़ी चेंज आया है और अब भारी भी हो गई है और डिफरेंट भी काफ़ी है आवाज़।
ओके, थैंक यू। अब मैं थोड़ा सा उस पर आता हूँ। थैंक यू तन्मय। अब मैं इस पे आता हूँ कि कुछ क्वेश्चंस वगैरह होंगे जो हमारे यूट्यूब चैनल के फैंस हैं, उन पे भी मैं थोड़ी चर्चा करूँगा। तो जो लोग भी ज्वाइन किए हैं, थैंक यू एवरीवन फॉर ज्वाइनिंग एंड वाचिंग अस। हियर वी कैन सी सुहास राय हैज ज्वाइन। थैंक यू सुहास राय फॉर ज्वाइनिंग। एंड सुहास राय क्वेश्चन इज, सर मैंने विदाउट गोइंग टू बैंगलोर कैन यू टेक ऑनलाइन थेरेपी प्लीज? Suhas, there are certain communication disorder, for that we provide online voice therapy, but who is the right candidate for online voice therapy and who is not the right candidate for online voice therapy? We decide, first step is the perceptual evaluation, then we suggest sometimes certain tests like stroboscopy, laryngoscopy, and based on all the information and based on the history, we decide who is the right candidate for the online therapy or who is the right candidate for the offline therapy. So our contact details are in the description of this live. So once you explore the description of this live, you'll find our website and you can click on website and then you can click on the reach me. And once you click the reach me, you will be able to find our contact number and our email ID on the Google Maps where the clinic is situated. So you can contact us and we'll guide you. So thank you, Suhas Ray, for asking the question. So after listening the voice, I will be able to guide you after perceptual evaluation. And those who are new to our YouTube channel, just for the information, like apart from treating puberphonia, feminine voice, and correcting the pitch and loudness problem, we also provide voice therapy for the people having hoarse, breathy voice due to vocal cord paralysis, those who are having a problem of fluency issue, stammering, and those who are having functional aphonia. Suddenly the voice has gone completely, there is no voice at all. And we have seen quite impressive result during the treatment of such communication disorder. And if you'll explore our YouTube channel playlist, you will be able to find what are the communication disorder. For that we provide the services. And if you'll explore YouTube channel playlist, you will find the pre and post treatment videos playlist, like vocal cord paralysis, stammering, puberphonia, high pitch voice, sulcus vocalis, phonatory gap, and spasmodic dysphonia, misarticulation, aphasia which happened after the stroke. So you'll find so many communication disorder, and that will give you an idea how a certified speech pathologist changes the life of people having the communication disorder. So when I told certified speech pathologist, means those are having the valid degree, because these days there is healthcare quacks and jhola chap doctor also, and they will write with their name speech therapist, SLP, voice therapist. So whenever you try to take any speech therapy service, try to find out few information about your therapist from like, and in which clinic or which hospital he works, and from which college he got the bachelor or master degree in speech language pathology and audiology field, or speech and hearing science, and he's registered in Rehabilitation Council of India or not. If he's registered, what is the registration number? So you try to explore all the details, and then you will able to differentiate who is fake and who is the real speech therapist. Fake will never give this kind of information. So because nowadays sometimes we see that there are people who try to do the self-treatment or try to take the speech therapy from healthcare quacks or jhola chap doctor or jhola chap speech therapist, and sometimes they will damage the voice and the vocal cord. So you should be very careful while taking the voice therapy, and because those vocal exercise what you are doing, that is important, and how you are doing, that is also equally important. So if you do the wrong vocal exercise or wrong way of vocal exercise, it is equivalent to a vocal abuse, and vocal abuse may damage sometime voice in the vocal cords. So when I'm talking about the vocal abuse, let's little bit understand, apart from the wrong exercise, there are certain other things also we can consider as a vocal abuse. For example, if you are shouting, that is also a kind of vocal abuse. And if you are a singer and trying to copy some other singer's style instead of developing your own, sometimes it creates stress on the vocal cords, so that is also kind of vocal abuse. Frequent throat clearing, like doing always you are doing, so both the vocal cords are getting friction, and that may also may damage sometimes vocal cords. So frequent throat clearing is also a kind of vocal abuse, and of course shouting and all, that is also a kind of vocal abuse. And so how to keep your voice healthy? Just for normal people, it's important for me, you, and those who are watching this live. So drink plenty of water. Water is a very good lubricant. So if you are drinking plenty of water, near about 10 to 12 glass, so it will give a good lubrication to the vocal cord. And because maybe you have seen sometimes some teachers, some singers will develop the vocal nodule because of overuse of the voice. And when like you have like any voice problem for longer duration, more than 2 weeks and all, so you should consult to a healthcare professional. They will try to understand what could be the reason, and then accordingly they will guide you. So drink plenty of water, avoid throat clearing, and sometime what happens when we sleep and we take the dinner, there will be no much gap, and so immediately after taking dinner, if you sleep, what will happen? The acid which will form for the digestion, that will come to the throat area, and that may damage sometime the vocal cords. So you can check if you have acidity or not. GERD, gastroesophageal reflux disorder, also sometimes may damage the voice and the vocal cords. And so there should be some gap between the sleeping time and your dinner. And of course, to keep your voice healthy, you can avoid too hot or too cold things, and if those things will create acidity in your stomach, that also should be avoided to keep your voice healthy. So but best thing for the voice is drink plenty of water to keep your voice healthy. And of course normal jogging, walking, doing some yoga and all, it creates good blood circulation in your body, and that also support in your voice quality. And when you are speaking continuously, in between you should drink water. So you must have seen in some debates and all in the TV and other places, the water bottle will be kept, because to keep moisture in your voice and vocal cords. And yeah, so I'm just trying to check if any questions are there. I will be answering apart from the vocal hygiene. Let's discuss. And there is a question of Devolupalli Swarupa. Sir, shall I come to your center? Yeah, you can come, but before that, we will try to understand your communication problem. So then only we will be able to guide if we can help you or not. So please call us, and our contact detail is, message for Swarupa for you is, you can go to the description of this live and you'll find our website. Click on the reach me, and then you'll find our contact details. So please call us. We'll do perceptual evaluation and then we'll guide you. एंड समीर रॉय इज सेइंग सर आपके साथ कांटेक्ट करने को क्या है प्लीज बोलिए सर. Of course, our contact details are in the description of this live, so please refer the description of this live. We'll guide you, will help you. And of course, there are certain communication disorder. For that, my team is trained in that much. They will be able to understand what mail has to be sent. So we usually send a mail, and sometime that will be not be. They will not be able to understand what communication problem the patient is having. So in that situation, they will connect the call with me, and then I'll be talk directly to the patient, and then accordingly we send a separate mail. And yeah, so of course, even based on the need, we do the consultation. Sometime like during the inquiry also, I do the consultation, teleconsultation, but not all the patient when it is needed. So it's very easy to contact with me. You can refer the description of this live. You will find our website. In that you will find our email ID and contact number. So thank you everyone for joining and watching us. And those who has joined newly, for them the message is, information is we are today live with Tanmay Gupta, and Tanmay Gupta was having high-pitched voice, feminine voice kind of a problem, and we did his pre-treatment live on June 23rd, and today we are after treatment live, and today date is 3rd July 2021. So please watch his pre-treatment live also, and that 23rd June live link we have given on the description of today's live. So please refer our description of this video or this live. So thank you everyone for joining and watching us, and thank you Manik for joining, and hi, Manik is saying hi. Thank you everyone, thank you so much for joining and watching us. So again I want to thank Suhas, thank you, and Devalupalli Swarupa, thank you, Sameer Roy, thank you for joining, watching, and Manik, thank you for thank you everyone for watching and asking the questions. Thank you so much. तो अब हम तन्मय इस लाइव को स्टॉप करेंगे. उसके पहले एक बार आप अपनी आवाज़ सुना दीजिए, क्या प्रॉब्लम थी और ट्रीटमेंट के बाद कैसे कमेंट्स आ रहे हैं, एक दो लाइन में, तब हम लोग स्टॉप करेंगे.
मेरा नाम तन्मय है, मैं अंबाला हरियाणा से हूँ. मुझे पहले हाई पिच वॉइस की प्रॉब्लम थी और उससे मेरा कॉन्फिडेंस भी काफ़ी कम था, और अब ट्रीटमेंट के बाद मेरी वॉइस नॉर्मल हो गई है. और मैंने अपने फ्रेंड्स को फ़ोन किया, उन्होंने भी कहा कि आवाज़ में काफ़ी चेंज आया है और अब आवाज़ भारी भी हो गई है.
ओके, थैंक यू तन्मय फॉर ज्वाइनिंग, एंड लाइव होने के लिए भी, प्री ट्रीटमेंट लाइव और पोस्ट ट्रीटमेंट लाइव होने के लिए थैंक यू सो मच. और आपकी वीडियो के माध्यम से कई सारे लोगों को एक मोटिवेशन मिलेगा और अवेयरनेस में भी हेल्प मिलेगा कि इस तरह की प्रॉब्लम का समाधान संभव है और वो लोग सही जगह
आपका माइक ऑफ है.
ओके, सॉरी. थैंक यू तन्मय कि आप ज्वाइन किए ऑनलाइन वॉइस थेरेपी के लिए हमारे सेंटर पे, और आप लाइव भी हुए प्री ट्रीटमेंट एज वेल एज पोस्ट ट्रीटमेंट, और आपकी वीडियो के माध्यम से लोगों को आशा की किरण मिलेगी. और जो लोग इस लाइव को देख रहे हैं, मैं फिर से रिक्वेस्ट करूंगा कि हमारे इस लाइव वीडियो को जो है, अगर आपको तन्मय की प्री और पोस्ट वॉइस में चेंज दिख रही है तो लाइक कीजिए, शेयर कीजिए, ताकि इनके जैसे प्रॉब्लम वाले लोगों तक बात पहुंचे और वो सही जगह पे पहुंच के अपना ट्रीटमेंट करा सकें. तो थैंक यू एवरीवन फॉर ज्वाइनिंग अस एंड वॉचिंग अस, और थैंक यू तन्मय आपको भी कि आपने हम पे भरोसा किया. अब हम लोग इस लाइव को स्टॉप करेंगे. थैंक यू सो मच एवरीवन.